This is the most terrifying medical condition that you have probably never heard of. It's called split brain. And it's when the brain's hemispheres are physically separated, which creates two separate consciousnesses inside of one body. Imagine if someone cut your brain in half while you were awake. You would immediately feel a sharp, excruciating pain. But after that pain would come a whole host of other problems. Since the two halves of your brain would no longer be connected, you would no longer be able to walk or talk. The left side of your brain controls the right side of your body, and vice versa. So without the two sides being able to communicate with each other, you would essentially become paralyzed. But perhaps even scarier than that, because the two sides of the brain are also responsible for processing visual information. You would quite literally be blind in one half of your visual field. If the right side of my brain were to stop functioning, for example, I would no longer be able to see anything on my left. But even though these patients can't move or see out of one side, they are still conscious. They can think and reason and feel emotions. But because the two sides of their brain can no longer communicate with each other, these thoughts and feelings become fragmented. The right side of the brain processes emotions, and the left side is responsible for language. So if the right side were to stop working, you would no longer be able to cry or feel any other emotions, but you would still be able to talk and write and read. And perhaps most terrifying of all, when you looked into the mirror, you would only see half of your face. I mean, just imagine the psychological effects of that. But how can this even happen? Well, the only way that we know of is through surgery. Back in the 1960s, some patients suffering from severe epilepsy had their corpus callosum severed in order to reduce the frequency of their seizures. The corpus callosum is the bundle of neurons that connects the two sides of the brain. So by cutting it, the two sides can no longer communicate. And while this surgery did reduce the amount of seizures that these patients had, it came at a pretty steep price. All of them suffered from depression and anxiety, and many of them ended up committing suicide.
There is, however, one way that this condition can occur naturally.
It's extremely rare, but every once in a while, a tumor will grow in the corpus callosum that can physically separate the two sides of the brain. If this happens, the person will experience all of the symptoms that we have talked about today. But there is hope. Doctors can use a laser or other forms of energy to destroy the tumor and reconnect the two sides of the brain. And if this is done quickly enough, the patient will make a full recovery and be just like normal people. If you want to hear more scary medical stories, stay tuned.